Okay, so here we are again, back to the basics for chronic kidney disease. You may be thinking to yourself right now, after there's been so many videos, that my goodness, this doesn't seem like the basics because there's a lot of basics. Well, there is because kidney disease is pretty complicated. But today we're going to talk about acid base balance, which is a very basic thing you should understand for kidney disease. So, again, let me remind you as I'm sharing my screen that this is for general kidney disease. It does not take into account your specific diagnosis. Okay, what do you need to know about acid base balance? So, we're going to describe today the functions of the kidney when it comes with acid base balance and major steps you can take to help your kidneys out with this process. We want to talk about what is a normal bicarbonate level. That tells you a little bit about your status as far as acid base balance goes, and some negative consequences of being in acidosis and the benefit of fruits and vegetables. So, how do kidneys maintain acid base balance? Well, what they do, it's a two-step deal. They secrete hydrogen ions into the urine, and then they reabsorb what we call bicarbonate, which is alkaline, back into the blood. So if you think about your kidneys, I call them the master chemist because all your blood all day long flows through your kidneys, and they decide, hey, what do I need to do with this? Do I need to keep it? Do I need to excrete it in the urine? All sorts of things like that. They even make hormones. They just do so many things. They're fascinating. So, but as kidney disease progresses, this becomes harder. Your kidneys are having a harder time of performing all the jobs that they do. And so the body will become more acidic. And that is defined as a serum bicarbonate less than 22. So you can see that on your labs. It'll either be like CO2 or serum bicarbonate. I always look for this number because there's a good reason. Why do I care? I look for this number because there's a good reason for you to care, because serum bicarbonate is an independent predictor of CKD progression. So we need to know what this is, and if it's out of whack, we need to fix it. Okay. Other reasons besides kidney disease decline. So remember, I tell people all the time that yes, I'm focusing in on your kidneys, but I also look at your whole body because that matters too. You still have a brain and a heart and blood vessels and skin and all these things. So what else happens with acidosis? Well, you have an increased degradation of muscle protein and muscle wasting. We definitely don't want that, especially as we get older. Destructions of bone and bone disease, which is already characteristic of kidney disease. Decreased albumin synthesis and hypoalbuminemia. So low albumin, that's really, if someone's on dialysis, which we're not talking about dialysis right now, but it's a predictor of mortality. You just don't want that to be low. And hopefully you never end up on dialysis. But if you do end up on dialysis, you do not want to start with a low albumin. Increased rate of CKD, which we've already talked about that. Stimulation of inflammation. So remember, we talked about inflammation last week. This is another reason why you might have inflammation. And then impaired insulin secretion and responsiveness. So if you are diabetic or pre-diabetic, you definitely don't want that. How can I help my struggling kidneys with this process? So what you want to do is decrease the number of hydrogen ions that have to be excreted, right? That makes sense. And increase the amount of bicarbonate in the blood. If you do that, you've just kind of done the job for them. They don't have to work so hard. So, how do you go about doing that? Well, diet is known to be the most important individual factor that affects acid base balance. It goes back to diet. So now what do we do? Okay, so now we've got to look at what we call the potential renal acid load of foods. So whenever you eat a food, when you take it into the body, it is either going to be acid or alkaline. It's not what it is outside the body, it's what it is inside the body. So outside the body, a lemon might be acidic, but when you take it inside the body, it's very alkaline. Okay. And so we can look at this potential renal acid load, and there's lists and they give numbers. So I'm going to show you an example here. You want the potential renal acid load of food to have a low number. So, for example, fruits and vegetables have negative numbers. I'm talking fibrous vegetables here for the most part. Milk and dairy products have a +1. But then if you look at all the animal products, they are highly acidic. So you want to stay away from those. That's another reason we eat a plant-based diet. It can be argued too that some grains have a higher acid load, So if you have problems with CO2, it's really important to really boost up the fruits and vegetables. And this is just a pH scale showing kind of where you want to be. And it's really showing the difference. I think sometimes I should take this out because it might make things more confusing because alkalinity is a higher number, but potential renal acid load, you want a lower number. So it can be a little confusing, but just know that when you're looking at potential renal acid loaded foods, you want a low number. All right. What about supplementing with sodium bicarbonate? Where your doctor may do this and never ever change a medication that your doctor gives you unless you ask them. I may make sure that it's okay. But you could supplement with sodium bicarbonate. Sometimes, if I get somebody whose CO2 is like really, really out of range, I will tell them, like, for the first month or so that we're working together, what I want you to do is take a teaspoon of baking soda, put it in water, and drink it every day. And that's just making them more alkaline. Usually after we do that for a month, then they're alkaline, they're eating more fruits and vegetables, they don't have to do it anymore. The same could be true with sodium bicarbonate. If you're taking that and you start eating fruits and vegetables, you might be able to come back off of it. But sometimes doctors do this because patients get acidic and they don't know to tell them just to eat more fruits and vegetables. So the thing about sodium bicarbonate is helpful, but it has sodium. It increases your sodium levels, sodium bicarbonate. But the benefit of fruits and vegetables is that they boost fiber and vitamin intake and antioxidant intake, which we talked about when in the inflammation deck. They decrease sodium intake, decrease phosphorus intake, decrease oxidant intake. So there's just you get more bang for your buck if you boost fruits and vegetables as opposed to just taking a medication and carrying on with your diet. And that's true of any chronic condition. You always get more if you can control it with diet because you get much more benefit. Okay, so that's the end of that one. So, takeaways and to dos. Think about things we talked about today. If you go out to Amazon.com, you'll find my book there, Plant Fed Kidneys. Get the one that says for the patient because it does have a potential renal acid load in there, the list and everything to help you guide your food decisions. If you would like to schedule with me and you want to build insurance, you can scan this QR code right here and it'll take you right to my calendar. If you would like to self-pay, go to my website, plantfedwellness.com, and it'll guide you there on how to get in touch with me to set up an appointment for self-pay. So I hope this was helpful for you, and I hope it'll help you make some decisions when you're deciding what to eat tonight or tomorrow about keeping things in a more alkaline state. And I hope you have a very, very good day.